Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we have a unique show for you this evening. We're talking about physical therapy services offered at St. Luke's University Health Network. Tonight we'll be joined by a panel of talented experts from the field. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at physical therapy services offered at St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have an accomplished panel of guests joining us tonight. Up first, we have Matthew Johnson. Matt is a longtime resident of Bethlehem and a Bethlehem Catholic High School graduate. He completed his physical therapy training at Temple University, where he graduated with a Doctor of Physical Therapy degree. Matt is a board-certified clinical specialist in orthopedic and sports physical therapy. Thanks for being here, Matt.
Thanks for having me.
So you are an orthopedic clinical specialist in physical therapy. You work with a lot of athletes, both high school and college. What drew you to the field, and specifically orthopedics?
So I was injured when I was in high school. I had several injuries, one that kept me out a whole season football. So that experience, I think, really is what got me kind of interested in the field of physical therapy. The physical therapist I worked with was great. Really let me kind of understand why we were doing what we were doing and why we needed to prepare to get back to playing a sport again. And then really now I like working with the complexity of high-level athletes. So we have to prepare them to get back to all kinds of different movements and really slowly build up their strength so that they can handle these external forces, and really then also like to see them get back playing.
Great information. Thanks, Matt. Joining our panel next is Melissa Hager. Melissa graduated from Arcadia University with a Master of Science in Physical Therapy. She received her Doctor of Physical Therapy degree from the University of Scranton and completed her Physical Therapy Spine Fellowship at St. Luke's University Health Network. It's one of only 3 accredited physical therapy spine fellowships in the country. As a board-certified orthopedic clinical specialist, Melissa specializes in the treatment of orthopedic post-surgical patients and has a special interest in vestibular therapy and the treatment of positional vertigo. Thanks for being here, Melissa.
Thank you so much for having me.
So you just completed the St. Luke's Spine Physical Therapy Fellowship, and you're now a super subspecialist, I'm told, in spine physical therapy. This is a really unique distinction. Can you tell me a little bit more about what it means and why it's important to the patient care at St. Luke's?
Yeah, when I was younger, I was an athlete much like Matt was, and you have injuries. I also had a grandfather that had suffered a stroke and went through physical therapy, and I really was interested in that whole process to see how he went from being unable to walk to getting his life back. So that's kind of what piqued my interest as far as physical therapy. As far as the spine, in reality, I went through this because we see so many patients with low back pain or neck pain coming into my clinic, both chronic and acute back pain. And this opportunity came up, and I thought, oh, this would be great. I've been a practitioner for over 20 years, and I kind of wanted to prove that you can teach an old dog new tricks. And I wanted to really become, I don't want to say more modernized with my treatment. So that's kind of what piqued my interest. I went through the interview process and was selected and was very honored to be chosen as the first fellow for St. Luke's.
Well, congratulations.
Thank
It's very exciting. Let's meet our final panelist, Lauren Gargis. Lauren has a Master of Science in Physical Therapy from Arcadia University and is a board-certified clinical specialist in women's health physical therapy. She holds additional certifications in pelvic floor dysfunction as well as pregnancy and postpartum considerations through the American Physical Therapy Association. Lauren is the director of St. Luke's Pelvic Health Rehab Program and has contributed to articles on pelvic pain and incontinence for both Runner's World Magazine and Health.com. Thanks for being here, Lauren.
Oh, I'm so glad to be here. Thank you.
As a women's health physical therapist, you specialize on helping women in all stages of life, focusing on pelvic health. How did you get interested in this field, and what effect do you see that it has on women that may not talk about this?
Yeah, so I actually Missy and I went to grad school together, studied physical therapy together, so we've both been practicing for over 20 years. And I myself have 2 children. My daughter's 18 and my son is 15. And after my daughter Autumn was born, I had some common pain that a lot of women actually typically experience after they've had children. I waited a number of months and finally went back to my doctor and said, is there something we can do to kind of deal with these symptoms that I'm experiencing? At that time, which was about 18 years ago, he didn't really know where to send me, and in his defense, there was really nowhere to go in the Lehigh Valley. Pelvic floor physical therapy is actually not taught in our training. It's kind of additional classes that we take. So I signed up to take my first course, and I realized that there's a lot of need out there. So it kind of has just grown from there. And as far as prevalence, they actually say about 30 to 40% of women will experience some form of pelvic floor dysfunction in their lifespan.
Thank you all for giving us some background information on your expertise and your training. Next, we'll dig deeper into the services offered at St. Luke's. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now.
The team that we have put together of sport performance coaches and athletic trainers is why parents should choose St. Luke's University Health Network for their sport performance needs.
St. Luke's and our coaches are going to provide the safest and most comprehensive training environment that a student athlete would want. And I don't think there's anything in this area that can rival it.
I grew up in South Bethlehem. I'm married and I have 2 children. I really believe in public service. I think it's very important to give back to the community. In 1995, I was elected to City Council. And in 2013, I was elected mayor. And in 2017, re-elected mayor unopposed. And I just think it's important to give back to the community, and hopefully I'll continue to do that in the future. I've had an issue with my lower back on the right side probably for 30, 35 years. I would have spasms, I would get crooked. Being mayor for 8 years, I know there was a time about maybe a year and a half ago when I really threw my back out. And it was difficult to go to the office and sit and be in meetings. I was wearing kind of a support brace. That probably was the tipping point where I said, let's go to PT. I called Alex Brown with St. Luke's PT, who has an outstanding reputation. He's very professional, he's easy to talk to, but he's extremely knowledgeable and he's very professional, and he takes his time to explain everything to you and to really work very closely with you. I feel very good, much better, and the back is much better, and as long as I continue to do my exercises in the morning and in the evening, I think hopefully we made a lot of progress. I would give St. Luke's an 11 out of 10 because they went way beyond the call of duty. I just think we're very fortunate to have such a great hospital, and a hospital that's so diverse in so many ways. It serves the whole Lehigh Valley well, and I think that's important that we're very fortunate to have a hospital of the caliber of St. Luke's.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for watching our program and for providing us with questions for our panel, which we'll get to later in the show. Joining me is a talented group of medical professionals: Matthew Johnson, Melissa Hager, and Lauren Gargis. We've learned about their expertise. Now let's learn more about the types of physical therapy treatments offered at St. Luke's University Health Network. Matt, I'll start with you. Tell us a little bit about how the clinical team at physical therapy at St. Luke's assesses the pain, function, mobility in athletes. How do you really determine people who have sustained an injury, and where does prevention come in?
I think that, kind of big picture, if we're working with an athlete, we want to see how they move through that sport-specific range of motion and how they are moving. So, say a baseball pitcher would be a good example. I want to see either have them take video of him throwing, or I'll have him throw in the clinic so we can get an idea of where he has his pain in the motion. Is it something with that we need to alter, and that's the source of pain? And then when we get into the physical exam, there's some very common parts of the body that may be contributing to, say, like shoulder pain. It's not always the shoulder that's going to be the source of where the pain's coming from too. So, we look at the thoracic spine to see if there's, so maybe a mobility deficit there, that they're not really getting through the full range of motion of their shoulder because their thoracic spine is limited. Or, Another place that we'll look is the scapula, the shoulder blade, to see if there's muscle imbalances there as well.
Well, it's interesting you mentioned the body is so interconnected, and so you take a look at things, and I want to turn to you, Melissa, because you see this a lot in the spine. Lots of lower back pain. People experience it at all different stages of their life with all different causes. Is physical therapy the first line treatment? And if patients come to you, can they get results just from PT?
Yeah, for acute spine pain, physical therapy is a great primary defense or primary starting place. We get great results, and usually physical therapy is something that's going to take care of your pain immediately right away without having to take other avenues. So we can actually get the patient in the clinic without a physician referral. They can come to see us, and if it's not working, we can determine where you need to go next. We have that ability to send patients out to other clinicians.
Which is so important for patients to know, because they can start with physical therapy, but you are connected in the network if they need further care. Lauren, I want to turn to you for a second, because you were talking about the prevalence earlier in the program of pelvic health issues in women, but also in men. What are some of the common symptoms or complaints that you hear that people should use as a little bit of a red flag to maybe seek some help?
Certainly both men and women can experience issues with bladder control. The term for that is incontinence. And in women, we see that sometimes when they're pregnant or in the immediate postpartum period. And then sometimes in older women, we'll see that postmenopausal. In fact, the prevalence of that is actually about 50% of women experience urine leakage after the age of 65. And I think our society sometimes tends to almost like laugh or downplay about that, but that is not actually considered normal. So just because it's common doesn't mean that it's actually a normal thing for the body to go through. So treatment can really be helpful. In men, we will treat them sometimes after they've had prostate cancer. Maybe they've had their prostate removed. They may be experiencing some pain or some bladder control issues as well. There can be some sexual dysfunction that we can treat both in men and women. And sometimes we treat athletes. For example, cyclists, we'll see a number of, they may be having some tailbone pain, or that relates to pain with prolonged sitting. So there's a variety of conditions that we tend to see.
And a lot of things that really can be helped, that people do not need to sort of suffer in silence. And Matthew, you see this all the time, because you've got athletes, you've got weekend warriors, and people that think, well, I'll just take some Advil and rest my ankle and it'll get better. But in reality, there are a lot of things that can and should seek treatment. What are some common aches and pains you see that actually really require medical care?
So I'd say a lot of the chronic injuries that we see, someone that's been dealing with something for a little while, or an ankle sprain that someone can't get back to the normal activities that they want to do. Those are kind of two of the most common things that we see, especially like tendon injuries around the knee. The common term is like jumper's knee. So with those are probably the thing that I would say to not push through. You're talking about taking the Advil and just kind of pushing through it. I'd say if something's bothering you that long and it's affecting performance, especially, then it's time to get seen by a provider.
Seek help.
Yeah.
Melissa, let's talk about advanced spine therapy. People have common lower back pain all the time, and sometimes that can affect their neck, their middle back, their lower back. What are like some treatment guidelines that you follow, and what are some symptoms people should make sure that they absolutely get checked out for?
So St. Luke's has the comprehensive spine program, where a patient can call 1-866 St. Luke's and press option 6. They will be put on the phone with a nurse triage who will ask them a series of questions to determine what is the appropriate course of care, whether they're going to be referred immediately to physical therapy or maybe to another practitioner. When the patient comes to us as a physical therapist, we'll put them through an evaluation, and through that examination determine, is physical therapy appropriate? Or also at that point, if they're not getting the results that we are expecting, or if we determine there's something more serious going on, we also have the ability to refer to another practitioner as well.
Excellent. So it's good to know that people can get immediate care and immediate relief, and not to ignore those symptoms. Lauren, when someone comes to you with pelvic health issues, how are they evaluated? What can they expect? Because I know it's something that people might have trouble talking about in the first place, making an appointment. And if they come through the door, what are some of the therapies available to them?
So when we see a patient the first day, that's the evaluation day. So we'll start by really just sitting down with them and really getting their history and finding out what their concerns are and then what their goals are, really where they're starting, and then trying to devise a plan so we can get them to their better functioning or decreased pain. A treatment session will often involve, looking at kind of posture, looking at strength and flexibility. So it's very much like a traditional physical therapy visit in the beginning. But then the thing that kind of separates pelvic physical therapy is we often do an examination of the pelvic floor muscles, and that is generally an internal examination as long as we have consent from the patient. Treatment then, can be a variety of things, whether we're doing hands-on treatment or some specific exercises. And there's a lot of education because this is a part of the body that a lot of patients may not be familiar with. So we do a lot of anatomy education and a lot of kind of showing them pictures and videos and things so that they can get to understand how their body works a little bit better.
What great information from all of our panelists, but we're not done yet. After the break, we'll learn more about technology and new programs at St. Luke's. You're watching St. Luke's Health Now. Stay tuned.
So you're hurting. Is it your back or your knee? That old football injury? Get the rehabilitation you need. In most cases, you won't need a script from your doctor. In Pennsylvania and New Jersey, a law called Direct Access lets you see a physical therapist without a prescription. And if your insurance requires a prescription, physical therapy at St. Luke's will work with your doctor to get you the care you need that is covered. Let us speed up your recovery. We're in your neighborhood. Call Physical Therapy at St. Luke's.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on innovative medicine. I'm your host, Ashley Russo, and we've had a really interesting show with you tonight. We're talking about physical therapy services offered at St. Luke's University Health Network. And in case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, Matthew Johnson, Melissa Hager, and Lauren Gargis. Thank you all for being here. In the first part of the program, we talked more about your backgrounds, your expertise, and your interest in physical therapy. Let's dive deeper now into technology and services available right now for patients in need. Matt, let me start with you. The physical therapy at St. Luke's location at Moravian University campus. This is a really unique place that provides really cool care and access for athletes. It's got state-of-the-art care. Tell us a little bit about the facility and the broad scope of the services that are offered there.
So really, we designed this clinic with athletes in mind. So we have an area of turf where we do a lot of our functional, testing and plyometrics, agility, kind of getting our athletes ready to get back to sports. We have some really unique pieces of equipment too. We have blood flow restriction, EPAT, and anti-gravity treadmill, which we have out of a lot of our other clinics too that treat athletes. And that's really unique. We can actually decrease the patient's body weight down to 20%. And really that allows us to run a little bit sooner. And we can kind of get them through the return to running protocol without them experiencing any pain.
And how great has that collaboration been with Moravian University and having hands-on access to those athletes?
Yeah, it's great. So a lot of educational experiences too. So they just started a PT program, so we collaborate with them on that. We have a PT that spends some time in the training room, so there's a lot of collaboration on care with the athletes, and that's been really great as well.
Well, you mentioned education, and Melissa, I want to turn to you because how important is the patient education piece, especially when treating back pain? I know that I had some back pain years ago, and it was actually attributed to needing to stretch out my quads and my hamstrings more. It really wasn't my back. And so a lot of it was me being educated on my own body and then doing the work at home. What role does that play in your practice?
I think patient education is number one as far as the most important thing. Patients come to the clinic, they want to know why they hurt. So whether that's talking about anatomy, as Lauren had stated, or looking at their movement, but explaining to the patient why they hurt. Patients want to know why they hurt, what they need to do to make it better, how long is it going to take, and how much is it going to cost them. So I think that's the number one. By educating the patient, they also buy in to why physical therapy is going to help them. So as far as the therapist goes, I think it's integral that day one you start to educate that patient immediately, whether it be through a simple anatomy lesson, a home exercise program, but it improves compliance and the patient buy-in. And it's going to improve the outcomes in the end because the patient's going to understand why they're really there and what they're going to need to do themselves to get them through and get them better.
I love the idea of them being really a part of the entire process and understanding it. And for you, Lauren, there's all kinds of technologies that are used. So tell us a little bit about, women's health and the pelvic area of physical therapy. What technologies are being used and how important is it for patients to understand their access to technology?
The pelvic floor itself is, we often tell our patients, these muscles are invisible, really. The bicep, the quads, you can kind of see them on the body. But the pelvic floor is comprised of muscles at the very bottom of your pelvic bones, and they are not something we can see. So a really common modality that we use is something called biofeedback. And most patients find this really interesting. We actually use skin electrodes to place on the skin on the outside of the body, and the patient and us as clinicians are able to look at a computer screen, and it shows how the muscles are functioning. So it shows us the power that these muscles can produce. It shows us if they're relaxing correctly, and then we will then have them move, and we'll see how are their muscles working with actual physical activity. Some other modalities and technologies that we have are real-time ultrasound, which allows us to also look at muscles with movement, with activity. We can do electrical stimulation. Sometimes we'll have patients use some tools themselves, which might include things like vaginal dilators if they're having some pain. That's like a home type of thing that they do, and we'll train them and teach them how to do that. So we're really fortunate to have a number of variety of things at St. Luke's to help patients to understand.
Well, you mentioned at home, and I know that there are things that you can get from your physical therapist that you can use in your home treatment. What about you, Melissa? What do you see as the physical therapy technologies that you're both using in practice and that people can utilize at home if they're in practice with you?
So in my clinic, I'm actually fortunate that we have a pool. It's one of 3 in the entire network. So patients with chronic pain tend to do very well in the pool. So we'll have a lot of patients referred from pain management that come in that maybe aren't able to move their body on land because of the effects of gravity and the extra stress that it puts on their body, and we can get them in the pool and get them back to movement where it's not so painful. The other thing some of the clinics have is mechanical traction. So whether it be for the neck or the lumbar spine, we're using traction, which is pulling, to increase space and to decrease their pain. The other things we do, as I stated before, is the home exercise program is really integral for the patient to be compliant with their program and to really achieve the best results. Those are probably the 2 biggest things outside of the normal stretching, range of motion, and modalities that we use that are beneficial in addition to traditional physical therapy.
What about you, Matt? With the athletes, I would imagine that you see them being pretty goal-oriented, right? They want to get back to their sport, back on their field. But how important is the combination of technology and innovation as well as what they do at home?
So, technology is great. We can give them a home exercise program, which we've talked about a little bit, but there's a program that we use that we can share updates with them kind of continuously. So we can give them, specific things. I have someone currently that's coming back from an ACL injury, and I have kind of set days of what we want to do, and we kind of can build that into that program, and she knows that she has to check it off and complete it online, and that way I know she did it, she knows she did it, and we can share that information. She's working with a athletic trainer at school too, so we all know that she's doing what she needs to do to get back to playing.
Thank you all for such an engaging conversation. Up next, questions from our viewers. Stick with us, you're watching St. Luke's Health Now.
St. Luke's has been a cornerstone of the Lehigh Valley for over 150 years. It was originally founded to provide industrial workers with immediate local access to care. In the last century and a half, while healthcare has transformed dramatically, St. Luke's dedicated physicians, employees, and volunteers have proven they can respond to changes with exciting, innovative, and bold healthcare solutions. St. Luke's ability to deliver the highest quality care at the lowest cost is truly transformational and will ensure our future.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation about physical therapy at St. Luke's University Health Network. Now we're going to read some questions from our viewers. All right, are you guys ready?
Sure. Yes.
All right, Matt, I'm going to start with you. This viewer writes, I was trying to rehab a sprained knee on my own at home, but the pain is still there. In fact, it's getting worse. Where should I start to get the right care?
Yeah, I think it's great that you already tried starting to rehab it a little bit on your own. Probably direct access eval will be the next step. We could direct access is just seeing a physical therapist without a referral from a physician. Probably what I would do then is look at the exercises you're already doing and then see if that was maybe actually increasing the pain a little bit. And then, from there, we could do an evaluation, look at, is there something more going on than just that? Do you need a referral to, orthopedics, or is there something else that might be causing that pain?
But that direct access is so key, and patients have that at St. Luke's, which is great. All right, Melissa, I think this one is for you. This person writes, as I am getting older, I've started to experience low back pain that interferes with my day-to-day activities. Should I start with physical therapy or check with my family doctor?
So again, with direct access, the comprehensive spine program, physical therapy is a great starting place. Saves time. We can get you better faster. You come in for a physical therapy evaluation, we can determine what the underlying problem is and get you the right type of care at the right time.
Well, I can attest that every member of my family, for something different, has gone direct access to St. Luke's physical therapy, and it's been incredible. And if an orthopedist is needed or some other caregiver is needed, we're referred right away, whether that be imaging or anything else. So I can tell this viewer for sure this is great direct access at St. Luke's. All right, Lauren, we've got one for you. This viewer writes, I gave birth to my twins 6 months ago and I now experience episodes of incontinence. How long would a course of physical therapy be before I would see results? And are the results long lasting?
Good question. So, we've talked a little bit about the fact that incontinence may be common, but not necessarily normal, but not necessarily in someone who's just given birth. Incontinence is fairly common in that time, but by 6 months, she should be starting to be able to have a little bit improved control. So what we would think for a course of treatment would probably be about 2 to 3 months. We would start weekly and really go over some of the strengthening exercises and kind of applying that into holding her babies, feeding the babies, and how does that affect really how her muscles work in her body. And as she's kind of doing her homework, we would anticipate that we'd be able to decrease the frequency, maybe see her every other week. Hopefully by 3 months, she should be feeling that she has improved bladder control and that she can continue on her own at that point.
I'm sure, like many new mothers, she's thinking, how do I get to physical therapy with babies, especially twins? Yeah. So it's great to hear that you incorporate the kids into the physical therapy. All right, we've got somebody here with shin splints, Matt, so I think this is for you. As a runner, I tend to experience shin splints from time to time. How might physical therapy help with the pain or help prevent the issue from happening in the first place? Super common, right? Yeah. Shin splints, kids get them, teens get them, adults get them. What do you do?
Yeah, so there can be a couple of different causes for shin pain, shin splints. We have a group of therapists at St. Luke's that are part of the Running Institute. So one of the things, I'm part of that as well. One of the things that I would do is look at, probably video motion analysis of how they're running. They might do something called overpronation, where they kind of roll their foot in, and that can actually place some increased strain on the inside of that shin bone. So if they were in the wrong pair of shoes, or say they're in the right pair of shoes and we need a little extra support, that's where maybe a custom orthotic might be helpful to help.
It's amazing, right? We think we are all just running, but meanwhile our body shapes, our legs, feet, makes it all different. Everybody's run is unique, so good to get evaluated. All right, Melissa, I'll go to you. Right now, I go to a chiropractor regularly for my back pain. Is there a difference between the care that I receive there and the care provided by an advanced spine physical therapist?
So in physical therapy, we are movement specialists. So we're not only looking at spinal alignment, we're going to look at movement, muscle strength, power, posture, muscle coordination, and we're going to look at how the person is moving and what we need to do to fix the problem long term. So that may be strengthening, it may be immobilization, it may be daily stretches. We're looking at the long-term solution for this patient.
Excellent. All right. I've got one more here for you, Lauren. I suffer from endometriosis and it causes me a lot of pain. What kind of physical therapy treatment might be beneficial to help control my symptoms? Not something that I would think could be treated with physical therapy, but it can be.
Sure, yeah. Endometriosis is actually a chronic pain condition, and what it is the lining of the uterus actually kind of moves outside the uterus, and it can cover the bladder, it can cover some of the intestines and things like that. So from a physical therapy standpoint, we will see muscle dysfunction usually as a result. The pelvic muscles kind of tense up and almost hug and protect those regions down in the pelvic cavity. So an important part of treatment is helping patients to identify how to relax and release those muscles in the body. But something like endometriosis would definitely be a multidisciplinary treatment strategy. So we would be in touch and kind of collaborating our care with urology, potentially gastroenterology, definitely OBGYN, and sometimes some of our pain specialists and pain management as well.
Thank you so much to all of you for being here and for all of you watching at home. For more information on physical therapy at St. Luke's University Health Network, please visit their website at sluhn.org or call 1-866-St. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well and remember it's important to focus on your health now.